Good afternoon. It's December 8th, 2021. Welcome to RMC Facebook Live. And we're talking about COVID-19 and the variant and vaccination. My name is Magadia. I'm an infectious disease specialist. And today, in particular, we'll be talking about Omicron. A lot of people pronounce it Omicron. The actual Greek pronunciation is Omicron. It's also known as B11529. It's a highly divergent strain. What that means, it has a lot of mutations. It was initially found, it was not really discovered, but it was first reported in the northern part of South Africa, where Johannesburg is. That part of South Africa shares borders with Botswana and Zimbabwe. Johannesburg Airport is an international airport. The reason why I'm saying that is there's a lot of cross-border travel in that part of South Africa. So by the time that they reported that in mid to late November, there's a great possibility that it has spread multiple countries in that particular region. It was only reported in late November, but there's some data that it has been spreading around 1 or 2 weeks prior to that. So the reason why we're talking about Omicron is there's a concern because of the highly divergent nature. It has about 50 mutation in the amino acids. 34 of them are really significant. As a perspective, Delta has about 12, maybe 14 amino acid changes or mutations. This one has about 34. Actually, technically speaking, it has about 50, but 34 of them are really significant. So about 10 of those mutations it shares with some other strains like Delta, Alpha. There's about 20 mutations that we don't know yet what it's capable of doing. The reason why we keep on talking about the mutation in the amino acid changes is most of the mutations happen in the terminal binding protein or the end terminal and the binding receptor domain, and that encodes for transmissibility, meaning that binding protein is the one that you kind of latch on that immunoglobulins. So these amino acid changes kind of make it appear that this variant might be much more transmissible because the ACE2 receptors, which we all have up under our nose, this receptor changes or this amino acid changes, they use that ACE2 receptors. So seemingly, it might seem that this might be much more transmissible. So I'm here to talk about 6 major questions that a lot of people have asked me the past 2 or 3 weeks or so. 3 of those 6 questions are really major. I think they might have been answered yesterday or this morning by some data from UCLA. There's a paper that came out from UCLA yesterday, and there's some data that came out from South Africa last night and this morning. So the first 3 major questions are transmissibility, meaning how contagious this thing is. The second one is pathogenicity. How serious is this thing? Is this going to be the second wave of Delta, being much more pathogenic or much more much deadlier? And the third question is immune escape, meaning is I'm vaccinated, I'm even fully vaxxed or boosted up, am I going to be at risk? So those 3 major questions I'm going to try to answer. The other 3 minor questions are reinfection. So I've had COVID before, a few months ago, maybe last year. Am I at risk for getting this variant? The 5th question is, what do we do treatment-wise? And the last question is testing. So let me just dial down on those 6 questions. So the first 3 questions, transmissibility. Okay, so how contagious is this thing? So based on those amino acid changes that I talked about, they have more amino acid changes. They have more mutation. That means they have more affinity to ACE2 receptors up on the nose. So based on that, theoretically speaking, you would think that this is much more transmissible. So last week we didn't really know the answer to that, but this week we kind of do know based on this the data from South Africa, and it seems like that it's much more transmissible. So that's the kind of the short answer to the first question of transmissibility. The second question is pathogenicity. So how deadly is this thing? So unfortunately, the answer to that is still not known because we have very few data coming from South Africa and some other states as well. As an aside, there is, as of this morning, there is no documented cases in the state of Alabama yet. I think about several cases in Georgia this past weekend, several cases of in Louisiana last week, and I think about 2 cases in Mississippi yesterday. But when I looked this morning before my clinic, there's no official documented case yet in the state of Alabama. That being said, most of the cases reported in South Africa and even in the States are mild cases, not warranting hospitalization. So that's a good sign. So that means that maybe it's the common cold. Also, the data coming from South Africa show that most of the cases are younger folks, college age kids, even 5-10-year-old kids, and they usually manifest with mild to moderate symptoms, URI or upper respiratory tract infection symptoms, runny nose, maybe dry cough, not really warranting to be hospitalized like what people we see here in the hospital, really short of breath, oxygen level going down, chest pain, and those kind of things. So we don't really have data on how deadly this thing is because most of the things reported in the literature are mostly mild to moderate symptoms. The third question is immune escape. So immune escape basically, are the vaccines effective? So one of the several of the mutations may be in code for immune escape, meaning the vaccines might not be as effective. But there's a data from UCLA yesterday that was published from yesterday. It's a very small population that suggests that if you have been infected before, whether it's last year or this year, plus you get vaccinated, we call that hybrid immunity. Immunity from natural infection plus immunity from the vaccination itself. It offers better protection compared to having just immunity from infection alone or immunity from COVID vaccination alone. So the hybrid immunity might be better for you as far as protecting yourself against this particular variant. That paper also suggests that in lieu of that hybrid immunity, it's as good as hybrid immunity if you have been boosted. So that means vaccination plus vaccination is as good as infection plus vaccination. So it's not quite hybrid immunity, but having gotten a primary series of either Moderna or Pfizer, 2 doses of that, plus the booster, or 1 dose of J&J plus a booster of J&J equals hybrid immunity. So that means it offers you good protection against this particular strain. So that's from data from last night or yesterday. So that's really good news. So which kind of segues me into, again, promoting vaccination. And if you're eligible, meaning it's been 6 months since your last shot, please do avail of the booster shot. So the next 3 questions about reinfection, treatment, and testing, I might have a little bit of answer, but it's probably an answer that you don't want to hear, because most of this are driven by the cases that we see, and there's not a whole lot of cases that were being reported right now. So the fourth question is reinfection. So I had COVID a few months ago. Am I protected against this particular Omicron strain? It doesn't seem like you are. So based on several data from, again, South Africa, reinfection is actually much more common with this particular strain, whether you were infected with the original wild type strain or the Delta strain or the Alpha strain. You could get reinfected with this Omicron strain, because they have, like I said, 34 really unique mutational changes in the amino acid level. So having antibodies against your previous, against the previous infection would not confer immunity against this particular variant. So which kind of segues me into suggesting please do get vaccinated. And if you're eligible, get your booster. The fifth question is treatment. So what do we do? Again, most of the data that we're receiving from South Africa and some other states, they're mostly mild cases. So they're being sent home, quarantine, drink a lot of fluids, sleep on your tummy, those kind of things. Remdesivir, dexamethasone, IL-6 or interleukin-6 inhibitor, including tocilizumab. We don't have much in the way of data yet, because majority of the people are not that sick to warrant being treated with dexamethasone or remdesivir or tocilizumab. So we don't know that the answer to that particular question yet. The last concern is testing. So how do we test for it? So the currently available PCR testing should be able to pick that up. The PCR will tell you that you have COVID. You have been infected with this the virus called SARS-CoV-2, but the PCR would not be able to differentiate whether it's the regular strain or this Omicron strain. So the way that we could delineate or differentiate between strains is a testing called genomic testing, genomic sequencing testing. What it is, we kind of amplify the DNA and we sequence it, and so we'll know the mutation changes on particular chromosome or gene, and then we could tell that based on chromosomal changes or gene changes, we know it's this particular strain. We do not do that in the hospital. We have to send it out to a reference lab out of state. But the currently available PCR testing should be able to, whether it's a regular strain or this particular strain, should be able to pick that up. So those are the 6 major questions that I want to discuss today. I think there's a lot of talk about the surge coming. We're about 13 days, 3 days out from the last major holiday, Thanksgiving, and so far we have not really seen, knock on wood, a significant surge. We admitted one patient overnight related. They are kind of related to Thanksgiving dinner, but so far we have not seen, compared to the surge that we saw 7-10 days after Thanksgiving last year. But then again, it's kind of hard to compare 2020 pre-vaccination compared to 2021 with vaccines readily available right now. Then again, we didn't have variant strains last year that were reported. I guess we haven't been looking for it last year, but it's kind of hard to compare 2020 and 2021. It looks like it's almost totally different pandemics. But I'm gonna finish this up with the same things that we say over and over again. The 4 things that we say all the time that will get us out of this pandemic are the 4 things. W, 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 and V. So wash your hands, watch your distance, wear your mask, and please do get vaccinated, and maybe get a booster shot if you are eligible. Thank you. You have a good afternoon, and we're open for questions.
The one question was about testing for the variant. It says it still picks up as COVID on that test.
Yes, yeah. So I kind of briefly touched that the testing that we do, PCR, even rapid antigen testing, that should pick that up. But we are not going to be able to tell you whether it's that strain or this strain. We have to do further testing, and which takes about 2 or 3 days. Okay, so there is a question about people's vaccination record card, and so if you get especially here at the RMC, you get a vaccination card. I'm not gonna like this one, and on the front you get a sticker, and the sticker has the name of the brand, Pfizer, Moderna, or J&J, and there's a lot number, LOT number. It's like a 7-digit number. And beside that, there's an expiration date. That expiration date typically is December 31st of this year. That doesn't mean that your immunity expires December 31st, which is like 3 weeks from now. That means that particular lot expires or good until December 31st. It doesn't mean that your immunity will wane down after December 31st. So that is one of the questions asked of us, and just don't be worried. Don't get scared about that expiration date. It's just a lot expiration date. That being said, I think this might be one of the last ones that we have this year, but we'll have Dr. Free and I will have more information about when if time allows us. But be safe. We wish you a happy holidays and a happy new year. We'll have more maybe message in the next coming days or so. You'll have a good afternoon. Thank you.